So we have an 82-year-old male who presents with tinnitus. You may call that tinnitus, tachypnea, metabolic acidosis, and hyperthermia after ingesting a large amount of aspirin. Which intervention represents definitive treatment for severe salicylate overdose or toxicity? Would you say A, activated charcoal, B, hemodialysis, C, IV crystalloid bolus, or D, induced emesis? In the pre-hospital setting, if you're taking an EMT, AEMT, or paramedic exam, please do not pick inducing vomiting for any question. For any of you nurses that are studying for your NCLEX, chime in if you guys are inducing vomiting in any of your test questions. We will be staying away from D. But let's go ahead and talk about this test question. They're talking about somebody who ingested a large amount of aspirin. Know that aspirin overdose is the same thing as salicylate toxicity. So those can be used interchangeably, and you'll see those on exams. Now, there are a couple buzzwords that I'm always going to look for whenever I'm trying to determine, is this a salicylate toxicity, right? First one, tinnitus, ringing of the ears, is something that is very common on exams. Another one, small respirations or deep rapid breathing. In this case, they used tachypnea. And then the last one is metabolic acidosis. Now, if you are taking notes, I would definitely know those three buzzwords to figure out what's going on here. But we know that this is a aspirin overdose because they already told us. But let's go and look at some of these treatments. And all three of them are not bad, right? A, B, or C. Activated charcoal. If poison control tells you to give activated charcoal, definitely a consideration for an aspirin overdose. IV crystalloid bolus, not a bad answer either, but it's asking what is definitive treatment. For somebody with severe metabolic acidosis, definitive treatment for this patient would be hemodialysis. This patient is going to require filtration of their blood. Remember, they have a severe metabolic acidosis in this toxicity. A, B, and C were all good answers, but the best answer for definitive treatment was B, hemodialysis.